Hello everyone, it's Angelika Kargulewicz, clinical nutritionist, and if you are interested in the healthy nutrition and nutritional tips, please stay with me today. Today we will discuss the periodically very popular feeding model, the main idea of which is to limit carbohydrate and also with the high fat intake. But is it really a healthy diet? The ketogenic diet is a well-established nutritional model for drug-resistant epilepsy in children. But what is the most important here and should be emphasized is that it is not a cure-all. It is not effective for each of the child, but may be very effective in many cases of drug-resistant epilepsy. And what is the most important here when it comes to children with drug-resistant epilepsy? The introduction of the ketosis, so the start of the ketogenic diet, should always take place in a hospital setting. Can the ketogenic diet be helpful in other cases? Is it worth recommending? Of course, the ketogenic diet may possess some benefits for people with obesity, diabetes, neurodegenerative disease, even for people with cancer. But note that for now we have mainly research models with no long-term studies in humans, and this is a big limitation when it comes to following this diet in a clinical practice. From a clinical dietitian's perspective, it is worth to ask whether a particular dietary plan, in this case the ketogenic diet, could be my diet for the rest of my life. Am I able to function long-term on such a dietary plan, and does this dietary plan favor my eating habits and food preferences? If the ketogenic diet is meant to be only a one-off deviation from a general irrational dietary plan we follow on a daily basis, as is the case, for example, with obese or overweight patients who are trying to lose the weight very quickly, very often as an act of desperation, I would not advise you to go to this path. And what is the definition of the ketogenic diet? So this is a diet which significantly reduces the amount of the carbohydrates, no more than 20 to 50 grams per day, and as a result it enables the body to formate the ketone bodies. Does the ketogenic diet cause the weight loss? So in a short term, when it comes to less than 6 months, a hypocaloric, low and very low carbohydrate diet influences a greater degree weight reduction than, for example, a hypocaloric, high carbohydrate diet. But in the long term, greater than 6 months, there is no difference in terms of weight reduction between a very low and low carbohydrate diet and high carbohydrate diet. What is the mechanism behind the rapid weight loss on a ketogenic diet? So ketogenic diets correlate with water loss. And what is the reason for this? So mainly the depletion of the glycogen stores. For every 1 gram of glycogen, 3 grams of water is lost. Another reason is so-called natriuresis. A sodium loss is due to the lower insulin concentrations, and we also experience a reduction in the appetite. And what are the effects, the benefits of the ketogenic diet? So decreased level of glucose and insulin, decreased the level of glycated hemoglobin, and also improved metabolic parameters like lower triglycerides and also decreased transaminase activity, as well as hypotensive effects in terms of systolic and diastolic blood pressure. But on the other hand, we have also side effects like nausea, vomiting, headaches, constipation, diarrhea, and in the long term, kidney stones, especially if the protein intake is increased at the same time. And when a ketogenic diet can be harmful. Unfortunately, very low supply of the carbohydrate sometimes means also too low supply of dietary fiber. Too low supply of dietary fiber has a negative impact on our microbiota, a reduction in a butyric acid producing bacteria, and overall very low production of short-chain fatty acids, and those are very important to our health. Another drawback of the ketogenic diet is that sometimes people use the artificial sweeteners to increase the feeling of sweetness. But artificial sweeteners like acesulfame K and also sucralose have potential negative effects on the microbiota. Most neutral results are for stevia, but this also needs to be confirmed in the further research results. Another disadvantage of the ketogenic diet, which is poorly composed, is too much animal protein and too much animal fat. Fatty meat, bacon and butter, it means high supply of saturated fatty acids which negatively impact our microbiota. On the other hand, choline and carnitine contained in animal fat and animal protein, they are metabolized by gut microbiota to 3-methylamine oxide, and this TMAO, this is a risk factor for the development of cardiovascular disease. Apart from that, a long-term low-carbohydrate diet with a high intake of protein and animal fat stimulates a pro-inflammatory metabolic pathways, biological aging and also oxidative stress. High supply of the saturated fatty acids in a low and very low carbohydrate diet also correlates with an increase in LDL cholesterol, but this effect depends also on the genetic factors. This is why it is recommended to use a Mediterranean-style ketogenic diet including olive oil, nuts, avocado and salmon instead of fatty meat, bacon and butter. There is a potential risk of deficiency of B vitamins, calcium and potassium. Another problem with following the ketogenic diet may concern people with gastrointestinal problems like, for example, acute or chronic pancreatitis or, for example, gallstones. They may experience the exacerbation of the symptoms like diarrhea or indigestion due to too much fat in the diet. On the other hand, a concomitant high supply of the protein may also affect hypercalciuria and subsequent loss of bone mass. The ketogenic diet may also increase uric acid concentration. And also in the long term, a poorly composed ketogenic diet may also increase the risk of cancer development. Why this is happening? Because of the lower intake of dietary fiber, fruits and also vegetables. And are you sure that the ketogenic diet is right for you? It is worth to mention that there exists and U-shaped relationship between the carbohydrate intake and overall mortality. The results from a 25-year observational study published in Lancet document that the supply of the carbohydrate correlate with the survival length. What does it mean? So both diet with the too high supply of the carbohydrate, greater than 60% of energy from carbohydrates, and also with too low supply of the carbohydrate, less than 30% of energy from the carbohydrates, correlate with increased rate of mortality. And in summary, we certainly do not know yet everything about individual predisposition when it comes to the metabolism of some nutrients, so it is hard to say which diet should we follow, high carbohydrate, low carbohydrate or moderate carbohydrate. Perhaps a carbohydrate restricted diet, for example 100 to 150 grams of the carbohydrate, is enough to achieve your goals, and you do not have to follow very restrictive diet like ketogenic diet, 20 to 50 grams of carbohydrates per day. It is also vital to ask yourself whether this dietary model resembles your eating habits and whether are you able to follow it in the long term. And if you are following a carbohydrate-restricted diet, make sure you consume adequate amounts of dietary fiber at the same time, particularly the soluble fractions present in grains and seeds. This will allow for an increase in lactic acid bacteria and greater production of the short-chain fatty acids so important for our microbiota. In addition, to enrich the microbiota, it is worthwhile to take care of live bacterial cultures found in pickles, kombucha, kimchi and fermented cheeses a la Parmesan. It is also a good solution to follow a Mediterranean-style ketogenic diet including olive oil, nuts, avocados and salmon instead of butter, fatty meat or bacon. If you liked my video, please leave the thumbs up and please follow the channel, and I hope that we will see each other in the next episode.